A co-op blog is live here at the Federal Medical Center, Ebute Metta, Lagos, for the commissioning of a clinical building in the facility by the Honorable Minister of State Health and Social Welfare, Dr. Tunji Alausa. This is part of his effort to ensure that there is a revamp in the health sector. And of course, later today, we'll also be witnessing the inauguration of National Health Research Committee at the National Institute of Medical Research in Yaba, Lagos. So stay with us as a co-op blog brings you the coverage of this event as it unfolds. I am Babawale Solomon reporting for a co-op blog. The Honorable Minister for State Health and Social Welfare, Dr. Tunji Alausa, commissioned a fully equipped clinical building with In Vitro Fertilization Center at the Federal Medical Center, FMC Ebute Metta, Lagos. The commissioning of the clinical building took place January 4, 2024 under the leadership of the Medical Director, Dr. Adedamola Dada.
Fourth-floor building. It is going to improve the well-being of Nigerians. On the ground floor, like you can see, we have the new ophthalmology center. The reason why we have built a new ophthalmology center is because we realize that there has been a progressive increase in the number of ophthalmology patients that we see. Okay, and that ophthalmology center actually has 2 theaters, okay, and 4 consulting rooms. So we're going to be able to see more patients, and more patients will be able to have their surgeries promptly. On the other side of it is the IVF. We all know about IVF, okay, and we all know how expensive it is. But because we're a public institution and we have a very large volume of patients and quite a large number of patients who actually need these services, we have been able to do our calculations, and we are very confident that we're going to be able to crash the cost of IVF, okay, to Nigerians once we start working. On the second floor is a 50-bedded new admission facility, which is made up of both male and female general wards and private wards. Okay, that would increase the number of beds that we have in our hospital substantially, and quite a number of the patients who ordinarily would come and they will be told that there are no admission facility will now have admission facility. And then, of course, on the third floor we have a clinic. All right, and then we're going to have a cardiology lab, okay, which would make it easier for Nigerians to actually be able to evaluate their cardiorespiratory status and be able to see appropriate specialists promptly. Okay, so it's actually a building that has a lot of functions, and a building that many Nigerians would actually benefit from.
Following the commissioning of the clinical building at FMC Ebute Metta, the Honorable Minister for State Health and Social Welfare, Dr. Tunji Alausa, addressed the press on the present issues in the health sector.
Thank you for your question. You've asked 2 very important questions on the totality of our current healthcare system, and then the need to domesticate the national health insurance, our national health insurance. With all due respect, I would differ with you. The healthcare sector is not in shambles. It's not in shambles. Are we where we should be? Absolutely no. But are we working to quickly move to providing the best level of healthcare that is seen in every civilized society to our citizens of Nigeria? Yes, we're doing that. We're working so quickly to do that. And a lot of things have been done. I know they are not apparent yet, but you will begin to see several of these things in the preceding months to come and into the future.
He emphasized the need to domesticate the national health insurance and outlined the ministry's effort to improve governance in healthcare, making providers and institutions accountable. He noted the 3 pillars of their healthcare agenda, including enhancing governance, improving population health, and unlocking the value chain to contribute significantly to the GDP.
When myself and Honorable Mr. Pratte assumed the leadership of the ministry, following the directives that was given to us by President Bola Ahmed Tinubu on what he wanted to do with the healthcare sector in Nigeria, we did a big retreat at the Health Ministry. We came up with 4 pillars on how we will be revamping the healthcare system in Nigeria. The first one is We needed to improve our governance, which includes several things: holding ourselves accountable as healthcare providers, holding our institutions like Ebute Metta and thousands of healthcare institutions that we have in the country accountable, pushing ourselves on dealing with the patient, at which the citizens of Nigeria that are eventual patients, I will talk to them, I will provide care to them. That's one big pillar, the first pillar of our healthcare agenda. The second pillar of our healthcare agenda is improving our population health outcomes, strengthening our healthcare system, and I'll come to that in a minute. And the third pillar has to do with unlocking the value chain in our healthcare system, where we can begin to use healthcare as a major contributor to our GDP. If you go to other developed countries like in America, healthcare contributes about 23.5% of their GDP, which translates into about $3.3 trillion in annual spend a year. And as you know, healthcare is a major user of manpower. We can produce hundreds of thousands of durable, sustainable, high-paying jobs in our healthcare system. And that's what we're set out to do, and that's what we're working to do.
Dr. Alausa discussed the focus on workforce development, doubling the production of healthcare workers, including doctors, nurses, and medical scientists. The minister highlighted the importance of viewing healthcare beyond physical health and integrating it into the national security and social security framework. He expressed the goal of making the healthcare sector a major contributor to job creation and the economy, following successful discussion with potential investors.
If you can see now, I just had a meeting, a 30-minute phone call with the Honorable Minister of Trade and Investment, Honorable Doris Anite. We'll talk more. We're discussing how we're going to collaborate more to open our healthcare sector as a major contributor to job, as a major job contributor to our economy. And the fourth pillar of our agenda is we need to begin to see healthcare beyond physical health, but as part of our social security and national security. Now, let me go back to be more granular with your question. Our healthcare system is being strengthened today. You've seen we're aggressively increasing the production of healthcare workers. We've doubled the production with the number of students that have been admitted into our medical institutions, pharmacy, doctors, medicine, medical laboratory scientists, nurses. Between the time we came in as a government, they were enrolling about 28,000 nurses a year. Now, today, after this president took over, we've rejigged our nursing education. We're enrolling now about 66,000 nurses annually. And before the end of this year, we'll be enrolling over 120,000 nurses into our nursing school, even pharmacy school. And we've started a new program. If you heard the governor of Lagos State, Governor Babajide Sanwo-Olu, launched that, announced that program yesterday. We're going to be creating a corridor state to just strip out their current college of medicine that is attached to their university to be freestanding University of Health Sciences, like what the Lagos State government will be doing. They're creating a Lagos University of Health Sciences, where they can now aggregate all the general hospitals within the state, and they become teaching hospital hubs across the state. Once that begins to happen for Lagos State now, their LASUT is only enrolling about 30 students a year, but once this plan goes into place before the end of this year, LASUT at Lagos State University of Health Science will be admitting about 2,500 medical students a year. We're using Lagos to pilot this model, which we believe will work very well. And once it works, we will replicate it in all our 36 states of the Federation, including the Federal Capital Territory. We will leverage a population of 220 million people. We're very endowed by God. How many countries have 200 million people in the world? Just about seven countries. So we have to leverage our population, and that's what we're doing. We will produce more. It's a free world. People will go, but we'll have enough to service our healthcare system. And as we do that, as we continue to strengthen our healthcare system, people will come back, no doubt. What you say about Ebute Metta, I said I don't want to, as a Minister of State for Health and Social Welfare, I'm not going to be one of the choir singer for Ebute Metta. Dr. Dada is doing an amazing job. This is literally one of the best hospitals in the country. This hospital compares to anywhere, any hospital you go in the world. And we're very happy that this is a public hospital, not a private hospital, that compares. So that means we can do it. And not only Dr. Dada, I've met with all our medical directors of FMC's, new Psychiatry Hospital, orthopedic hospitals, and some of the teaching hospitals, CMBs. They're doing a lot. We're just not messaging ourselves. You go to these several of these FMCs, orthopedic hospital, neuropsychiatry hospital, and some of the creative things, if you care to listen as well, some of the creative things some of our neuropsychiatry hospitals have done, they've actually expanded the a la carte of care they provide to our citizens beyond mental health. They're providing care in also other medical specialties. They're bringing care closer to our people. And these are good, these several levels of care, very good care, sustainable care. But one thing that the government, what we need to tell our citizens, government is subsidizing this heavily. So, and these are, you get good care. I know we need to improve, and we're working so hard to strengthen our healthcare system. We're deploying more resources to infrastructure. We're deploying more resources to equipping our hospitals, getting all hospitals to have CT scan, MRI, digital X-ray, ultrasound. So we're doing this. So, and the president has given us all the support that we need to continue to marshal on this significant improvement that he wants in our healthcare system. Now, let me talk about your question about domesticating our national health insurance. That we're already working on that. If you saw that, we launched the SWAP approach, sector-wide approach programming, just a few weeks ago. That was launched by Mr. President, President Bola Ahmed Tinubu. It's now we're beginning to reaggregate our resources so that we can reduce the fragmentation that we currently have. We're mobilizing resources from the development partners together with what we have in the Basic Healthcare Provision Fund, so that we can channel more of this fund to the primary healthcare centers and channel more of this fund to our national health insurance, so that we can begin to enroll more people into our national health insurance, and then cover more people, get insurance and HMO to pay more for services, so that we can get our healthcare provider and facility to make more money, so that they can improve more on infrastructure, improve more on delivery of care, and improve more on the services they provide to our citizens. Like the president said, every single citizen of Nigeria deserves meaningful and comprehensive health care. But let me go back in history. The problem we've had is that we've let these pharmaceutical companies coming into our country. Go to Algeria, even other countries, they do things differently. When a company comes in, they give them license. You can only market for 5 years. After 5 years, you have to manufacture all those drugs in the country. But we just let these multinational companies come in, freeway. They come, and 20 years after, 30 years after, they're still marketing. They have not contributed to development of our country. That's the problem. We're going to the basis to change that. We have to make some legislation, we have to make some new laws, some new government policies. And if the president has to sign an executive order, trust me on this, he will do that. So we just don't want to approach this peripherally. We need to do a grander solution to this. But in the interim, we're talking to the local pharmaceutical providers to see what we can do. Today, I'll be visiting the federal laboratory in Yaba. We're trying to convert it to about a lab that we can do by equivalence, so that these are things we need to bring API, to get pharmaceutical companies to start making drugs using artificial pharmaceutical products here. Right now, a lot of the things we have is FPP, finished pharmaceutical products in our country. So it's a ground up solution that we're putting in place. What President Bola Ahmed Tinubu wants for this country is sustainable, durable, comprehensive healthcare. He just doesn't want us to scratch the surface. It's somebody that is very real and very truthful to Nigerians. He wants to fix the healthcare system and is working, deploying his own personal time, resources of the country into our healthcare system. I know things are hard, but Nigerians should bear with us. Things will get better in the not too distant future. Yeah, thank you. It's a multifaceted solution that we have to provide to this problem. Number one, you have problem of counterfeit as well. We're working with NAFDAC, custom, to reduce the importation of counterfeit drugs into our country. We're also working with some of the local pharmaceutical companies to increase production. And some of the companies that are planning to leave, we're talking to them to bear with us not to leave. And we're also working on various forms of backward integration where we can encourage local manufacturing in the country. Like I said, I just had a 30-minute phone call with the Honorable Minister of Trade and Investment in our country, Dr. Doris Adnete. It would discuss expansive plan on how we would strengthen our pharmaceutical industry in Nigeria. And as you know as well, as a ministry, Honorable Mr. Pati and I, we've put a plan together that's been approved by the President on unlocking a value chain. We have a Director General that will be starting, actually started now, that has the African Development Bank has been kind enough to release to Nigeria to come and work on a medical industrialization program. This involves bringing in private sector funding in Africa and the world to our country, hundreds of millions of dollars that we're hoping you'll be able to be mobilized to support our medical industrialization program. It's a big thing that Mr. Pati and I are very big on, and we know we're putting all our energy to ensure that this medical industrialization program starts quickly. We're going to be opening 6 medical industrialization hubs across the 6 geopolitical zones. In each of the geopolitical zones. So I know Governor of Lagos has committed land for us in the southwestern geopolitical zone. We'll be talking to the other governors on setting up these industrial parks across our country. So we're working to find it sustainable, durable, watch my word, durable and sustainable solution to our problem. We don't want to do patchwork. The President Bola Ahmed Tinubu does not want us to do patchwork.
Dr. Dada, who expressed gratitude to the Health Minister for his effort to revolutionize the health sector in the country, also gave an insight into the significance of the clinical building.
Everything in life you have to, as a process, okay? So we are working very hard to ensure that we're able to attract a lot more of the health workers to our institutions. And some of the things we have done actually is to now recruit retired health workers who are still very strong, who are still very able, okay? And they have been very, very useful, okay? So those ones have helped us substantially to actually reduce the kind of strain we're having sometime in the past. The other thing we want to do, and we're working on strongly, is for us to continue to provide a very good environment for our health workers to practice, such that we would actually not be losing very high number of doctors. But like the minister said, it's a free world. You're not going to be able to hold anybody tight and say don't travel. But we want to ensure that our environment, we continue to keep our environment competitive, so that if you are going to remain in the country, you rather remain with us. Yes. We are already practicing some elements of telemedicine, okay? For instance, if you come into this hospital now, we found out from our data that about 15 to 20% of the patients who actually come, they come because they want to come and check their laboratory results, okay? Today now we have softwares, we have QR codes that our patients can actually put on their phones, they can put on their computers, and they can sit in the comforts of their home and check their laboratory results without having to come to the hospital. They can also look at their basic medical history from the comforts of their home. Okay, we're working very hard at ensuring that we create remote consultation, but we have to do that within the ethics of the profession and within the laws of the land. So we're working hard at that. But we already practice some degree of telemedicine.
Subsequently, he explained how the facility was able to surmount the challenges of human resources and its commitment to creating a competitive environment, ensuring that the institution retains a higher number of skilled doctors. The commissioning of the new clinical building at the FMC Ebute Metta marks a pivotal step towards achieving the government's healthcare objectives. With enhanced facilities and expanded services, the institution stands poised to play a crucial role in providing accessible, affordable, and specialized health care, ultimately contributing to the well-being of the community it serves. The reward for hard work is more work. We've witnessed today the commissioning of a clinical building at the Federal Medical Center, Ebute Metta, Lagos, by the Honorable Minister for State Health and Social Welfare, Dr. Tunji Alausa. It couldn't have been better, as we've also witnessed today the inauguration of the National Health Research Committee by the Honorable Minister, and this is to ensure that our health sector competes with that of those in developed nations. This is a step in the right direction. This is a Cohort blog. For more news, information, trendy gist, and entertainment, follow us on all our social media platforms and subscribe to our YouTube channel. I am Babawale Solomon, reporting for a Cohort blog.